Hello, everyone. I am Dr. Sujit Sarkhel, Associate Professor of Psychiatry, Institute of Psychiatry, Kolkata. And today I'm going to tell you briefly about how to confront suicidal thoughts and ideations. As you all know, that suicide has become a very big menace in the entire world, and Indian population is no exception. In fact, recently it came out in an article in Lancet that India has recorded the highest number of suicidal deaths in the entire world, and it is definitely a cause of concern. And this month of September being the World Suicide Prevention Month, we need to talk about how to confront suicidal ideations in the common public. So, as you know, that suicidal thoughts usually come with some warning signs. So, what are those warning signs? Usually, a person who has a possibility of committing suicide would appear unduly sad and aloof, would withdraw himself or herself from others. And at the same time, maybe if they're taking a bit of alcohol or smoking, the amount of intake of the addictive substance would go up manifold. So one would be taking usually 2 to 3 pegs of alcohol, maybe would be drinking for the whole day. Such changes in behavior, along with maybe writing suicidal notes, giving away one's own belongings, and completely cutting off interactions with others, reducing reduced sleep and reduced appetite. So these are some of the signs that should alert persons near and dear ones about the possibility that the person may be considering an act of suicide or self-harm. And in such cases, one has to be alert, would try their best to ensure that the person opens up and comes up with the thoughts that are being pent up in his mind. And if all the attempts to communicate or to connect with the person fail, then it is always advisable to seek professional consultation with psychiatrists, psychologists, or any other mental health professional, or if they are not unwilling, at least to any medical doctor, so that to some extent the issue can be addressed. So, first is being aware of the warning signs of suicide based on which one can actually intervene. And another very important message that I would like to tell you is you must, all of us, must practice self care, and they themselves should encourage others also to practice self care. So, practicing self care means basically, waking up at the right time, going off to sleep at the right time, so maintaining a normal sleep schedule, also uh, taking regular exercise, taking proper diet, nutritious diet, avoiding excessive alcohol, smoking, coffee, things that can disturb your usual rhythm, and to maintain a relatively stress-free life schedule. And obviously, a minimal amount of maybe around 30-40 minutes of exercise can do wonders to your physique and to your psyche also. So once we are aware of the impending signs of depression and the warning signs of suicidality, and also what are the basic tenets of practicing self-care, I think we can do a lot to reduce depression and suicide in the long run. I think this is what I had to tell to all of you. And thank you very much and wish you all the best. Do consult a professional when you feel that you are really unable to cope with it on your own. Thank you. Thank you very much.